Assalamu alaikum. Today's article is titled Intracanal Cryotherapy Reduces Postoperative Pain in Teeth with Symptomatic Apical Periodontitis. It's a randomized multi-center clinical trial. The management of postoperative pain is essential in endodontic practice. The physiologic and clinical evidence suggests that applying cold through various methods may decrease the conduction velocity of nerve signals, hemorrhage, edema, and local inflammation, and is therefore effective in the reduction of musculoskeletal pain, muscular spasm, and connective tissue distension. So, the aim of this randomized clinical trial was to assess whether controlled irrigation with cold saline after cleaning and shaping procedures would result in a reduced incidence and intensity of postoperative pain in patients presenting with single-rooted teeth with bulbar necrosis and symptomatic apical periodontitis. In this prospective multi-centered randomized clinical trial, 7 certified endodontists performed the clinical procedure, and all treatments were performed over 2 appointments. For the patient selection and allocation, only patients presenting with single-rooted teeth with a single canal and a diagnosis of necrotic bulb and symptomatic apical periodontitis were included in the study. The patient was required to fill out a preoperative questionnaire that included a visual analog scale score to register the level of pre-treatment pain, and only those patients registering 8, 9, or 10 were included in the study. And a total of 210 patients met the inclusion criteria and were included in the study. And each facility participating in the study had a list of 30 random numbers assigned either to the control or experimental group. And the patient-related factors such as age and sex, as well as preoperative tooth-related factors, were registered. For the root canal procedure, all treatment were performed over 2 appointments as previously mentioned, and after doing instrumentation and final irrigation, at this time the assistant informed the practitioner as to which group the patient should be allocated. The patient was blind to the intervention assigned, and patients assigned to the experimental group received a final irrigation with the 20 ml cold sterile saline solution delivered to the working length using a cold sterile microcannula attached to the endovac negative pressure irrigation system for 5 minutes. And patients assigned to the control group were treated identically to the experimental group, except that the saline solution used for 5 minutes at the end of the first appointment was delivered at room temperature. And after these irrigation regimens, the patients were asked to fill out the VAS questionnaire to register their intraoperative pain, and root canal treatment continued as follows in both groups. The canal was medicated with calcium hydroxide, and the temporary filling was then placed. The patients were then informed that they could experience pain in the days immediately after treatment and were given a second questionnaire to record the presence, duration in days, and level of postoperative pain and analgesic intake. 3 vases were also included in the questionnaire to register the level of pain 6 hours, 24 hours, and 3 days after treatment. And the second session occurred approximately 7 days later. And in the result, the patients in the control group had a significantly higher incidence of postoperative pain with an odds ratio of 12.1, and the need for medication intake was also significantly higher in the control group with an odds ratio of 7.7, and none of the patient or tooth-related factor included in the study were found to significantly influence the incidence of postoperative pain. And the patients in the cryotherapy group suffered significantly less pain after 6, 24, and 72 hours and needed fewer analgesic intakes postoperatively. And finally, there were no significant difference in the incidence of intraoperative pain, whether cryotherapy was performed or not, and patients in the control group also showed significantly higher intensity of pain in general and longer duration. In summary, the result of this randomized multi-centered clinical trial allow us to conclude that cryotherapy reduced the incidence of postoperative pain and the need for medication in patients presenting with a diagnosis of necrotic bulb and symptomatic apical periodontitis.